Now, the next aspect of glucose physiology we want to talk about is glycalated hemoglobin, or sometimes called glycosylated hemoglobin. It means the same thing. But as you know, the hemoglobin is present in the red blood cells. So here we have a red blood cell. It's darker on the outside, lighter on the inside because it's a biconcave disc. And this red blood cell is going to contain hemoglobin. That's why the red blood cells are red. And if there's glucose in the blood, then some of that glucose is going to diffuse into the red blood cell. And what happens is the glucose becomes attached to the hemoglobin. And when there's glucose attached to the hemoglobin, that's called glycalated or glycosylated hemoglobin. And the amount of sugar in the blood is proportional to the amount of hemoglobin which becomes glycosylated. So if the amount of glucose in the blood is relatively low, then we're going to get relatively low amounts of glycalated hemoglobin. But if the amount of glucose in the blood is relatively high, then we're going to get relatively large amounts of hemoglobin. And this is the basis of the Hba1c test. Hb, of course, is hemoglobin. And the A1c is to do with the bit of hemoglobin which is glycolated. Now, you might remember that red blood cells live for about 120 days in the circulation. That's about 17 weeks. So they're actually hanging around for quite a long period of time. And once the glucose gets into the hemoglobin, it doesn't get out again, it's fixed. So if you actually look at the hemoglobin that's glycolated, that's actually giving you an average of the blood sugar levels over quite a long period of time. So the reason the glycolated hemoglobin test is so useful is it's giving an average of the amount of glucose in the blood over a period of time. And the amount of time it's giving you an average over is around about 8 to 12 weeks. So that test I did on my finger, when I just pricked my finger, that tells you what your blood sugar is now. But the glycolated hemoglobin, using the Hba1c test, gives you an average of blood sugar levels over 8 to 12 weeks. And this is useful for two reasons. Firstly, if someone has an elevated Hba1c, that might mean they're a diabetic who has not been diagnosed. And this is particularly the problem in type 2 diabetes. Someone can have it for months or years without being diagnosed. But if there's an elevated Hba1c, that's telling you a lot of their hemoglobin is glycosylated or glucalated, and that's telling you that the average blood glucose levels on average have been high over a period of time. And if the blood glucose levels are high enough to glucolate the hemoglobin up to the point of 48 millimoles per mole, then that patient is diabetic. This is a diabetic threshold. Now, what does this mean? Well, this means that there's 48 millimoles of glucose. That's the number of glucose molecules. 48 millimoles of glucose per mole of hemoglobin. So it's 48 millimoles of glucose per mole of hemoglobin. It's the amount of glucose in a hemoglobin molecule. And that equals about 6.5% of the hemoglobin being glycosylated. And actually at the moment in the UK, we're moving over to the millimoles per mole, millimoles of glucose per mole of hemoglobin, rather than the percentage. But 48 millimoles per mole equals 6.5%. Now, if someone's Hba1c, if their glycosylated hemoglobin is 48 millimoles per mole, that is 6.5% or higher, that is a diagnostic criteria for diabetes. That means that patient actually is in the diabetic range of blood sugar levels. So greater than 6.5% is diagnostic of diabetes, and that's 48 millimoles. per mole. Less than 6%, that's 42 millimoles. 6% is equal to 42 millimoles per mole. Less than 6%, less than 42 millimoles per mole, that patient is not diabetic. They're in a normal range. But what about the range in between? What about 6 to 6.5%? That is, what about 42 to 48%? Well, this can be a pre-diabetic level, illustrating the patient has glucose intolerance. So if the Hba1c is 6 to 6.5, that's 42 to 48, then that patient is at risk of going on to develop diabetes in the future. It's a pre-diabetic level of glycolated hemoglobin.